The following segment is sponsored by the Utah Center for Evidence-Based Treatment. I'm here at the Utah Center for Evidence-Based Treatment talking with Dr. Rowley. Thank you so much for having us out.
Thanks for having me.
Let's talk about your facility, what you do, and what makes you different from other places.
Yeah, so here at UCEBT, we're different than many other mental health facilities in that we are a team of psychologists who work together, consulting, supporting each other, and diagnosing and treating our clients. I run our assessment and testing program, where we really specialize in differential diagnosis for complex psychiatric conditions, and we see a lot of autism spectrum disorder, particularly in individuals who are older, teens, even adults, who aren't diagnosed until later than is typical because there's common misdiagnosis happening.
Let's talk about that a little bit more with misdiagnosis. Do you see that happen very often?
Oh yes, for many reasons. Firstly, individuals that have average or high cognitive abilities are sometimes harder to identify compared to those with language or other developmental delays. We're just beginning to understand how females or individuals assigned female at birth can often be overlooked because their presentation is so different than a male presentation, which is historically where we got our information from. And so in general though, if you're diagnosed much later on in life, you're probably going to have a lot of co-occurring issues going on, anxiety, mood, and trauma, because no one has quite gotten at that underlying issue.
Interesting.
Yeah.
And what can individuals look for, doctor, if they're thinking about that reflecting underlying autism?
So there's no one way autism can present, unfortunately, but we do see a lot of patterns. For instance, if you have a persistent struggle with maintaining relationships over time, maybe you can form some friendships or initial connections, but as those relationships become deeper and there's higher expectations, that could be more of a struggle. We see individuals, kids or adults struggle at school or at work, despite several different strategies or interventions. They have problems managing emotions, so we see anxiety, we see these temper outbursts that may be partially driven by sensory processing concerns. So in general, individuals that come to us have had lists of diagnoses, they've tried intervention after intervention and haven't reached their goals because no one's gotten at that root cause.
Interesting. And what resources are there for adults or loved ones maybe?
Yeah, so UCEBT, we offer comprehensive assessment because the first step to any evidence-based intervention is going to be a clear diagnosis. So we take a look at everything that's going on and really allows us to get that clear picture, allows us to tailor interventions to individual need. Then when it comes to interventions, we offer different types of therapies that could be useful for individuals with autism and their families. We have parent-child therapies or parent coaching for our kids. We have couples and family therapy for our adults, and we just have evidence-based treatments for anxiety, mood, and trauma.
This is such great information. Thank you so much for sharing this with us and these resources. If we want to make an appointment, where can we go?
So if you go to our website at ucebt.com and you fill out a new client form, anyone who indicates they're interested in assessment for autism will be scheduled with a free consultation with me so we can better understand what your needs are and how our services can meet those needs. And so yeah, just check out our website to get started.
Is that fantastic. Dr. Rowley, thanks for having us out.
Yes, thank you.